Ho ho ho, yo yo yo, Merry Christmas. Hey, what's up you guys? Welcome back to my channel, or welcome if you're new. My name is Autumn. I'm a licensed registered nurse, and in this video I want to talk to you a little bit about the pros and cons of being a registered nurse in the emergency room. So I've been in the ER for about 6 to 7 months now, and I have developed a pretty significant list of pros and cons. A lot of people were wondering what it's like to work in the ER, and if that's you, then just keep watching. This video is for you. Also, happy December 1st. Do you like my Christmas fit? Let it snow or something, or let it rain actually, because it's raining here right now in the Midwest. What is life? It should be snowing. I'll take it though. Pro number one to working in the emergency room is the team environment. It is such a team dynamic in the ER. I love it so much. You'll have people popping in and out of your rooms randomly, asking if you need help. You can also pop in other people's rooms and ask them if they need help. When an ambulance comes in and brings someone, you have a whole team to help stabilize that patient before you're kind of just left with them to carry out their plan of care. You're never ever alone in the ER. It's such a team environment. Everyone helps each other. There's really no such thing as like, oh, that's not my patient. We all kind of collectively work together to make sure that this person is safe, this person is kept alive. And yeah, it's just a really good environment. No hostility, nothing like that. The nurses and the techs really help each other out. And for that, I absolutely love the ER. Definitely a pro. Yo, there's a squirrel outside my window right now. Hold on. Sorry, I have a pea brain and I got distracted. Look at though. Oh, just kidding. He went away. Come back. If he comes back, I'm definitely gonna have to film him. That was so up close and cool. I love nature. Okay, second pro is that the doctors are right there with you. So unlike the floor, I've never worked on a floor actually, but I know that, if you need orders or if you just want to update a physician on the condition of your patient, you have to call cardiology, the attending physician, the doctor, whoever. And in the ER, you do not have to do that. You have the luxury of all of your doctors and physicians being right there. So if there's something that you need, or you have a question, or you're just concerned, you can just walk right up to him and say, hey, or her, and say, hey, come look at this patient with me. Like, I got a question. And most of the doctors are very responsive and super helpful. And so it's just really nice not having to go through the hurdles of calling somebody. All the physicians are right there, and they are very responsive to your needs, usually as the nurse. A con to working in the ER is that it is very, very stressful. I know that all of nursing has its ups and downs. All of nursing to some degree is stressful, but the ER is particularly intense. It's a fast-paced unit. It's very chaotic. You've got people running around everywhere. Sometimes you will go from having it be like manageable and controlled to having beds in the hallways, patients coming in and out of rooms. It just can get very hectic and very crazy sometimes in the ER. And even though to some degree I do enjoy it for that reason, because you're never really getting bored, it's insanely stressful, and I don't really have it all figured out yet in terms of how to calm down from that adrenaline rush. Even on my days off, I just find that I'm super exhausted. Yeah, it's very, very stressful. Definitely a con. This next one can be a pro or a con depending upon your personality, but it is that the ER is very fast-paced. So if you're someone who likes to get things done as quickly as possible, you're a fast worker, you're a hard worker, you enjoy being on your feet, for the majority of the day, the ER is probably a perfect place for you. You really don't have much of an opportunity to sit down unless, you really have to catch up on your charting. That's pretty much the only time. Other than that, you are like running for things 24/7, getting people warm blankets, getting people water, ice chips, medications. I mean, you're really working your beep off. And for some people that might be great if you have to be busy 24/7, but if you're a person who likes some downtime and you like to chill, the ER is probably not the place for you. Another pro to the ER is that you have tons of autonomy. A lot of the times you are the eyes and ears for the doctors and for the physicians, and so you're really like that first person on the line when you're seeing that patient, aside from EMS if they came in through ambulance. So in a sense, you truly are a first responder and you're playing detective. Again, you're the eyes and ears, so you get to call the shots when it comes to like ordering labs, overseeing and anticipating the needs of that patient. Maybe it's a stat EKG, maybe you anticipate you're going to need blood. You get to really spend a lot of one-on-one time with that patient, even though it may be short-lived. It may not be for long periods of time. You're popping in and out of that room constantly, and you're calling the shots, you're making judgments, you're using critical thinking. You have a lot of autonomy and a lot of room to really be yourself and really, give as much care as you want to give to that person. And for that reason, I love it. I think you're trusted with quite a bit in a very good way, and you have a lot of responsibility. At the same time, another con to working in the ER is that even though you're in and out of the patient's room and, you are the eyes and ears and you're with them one-on-one, sometimes it can feel as though you're not able to provide your best care because the ER is so crazy and chaotic and so busy. A lot of times at least I feel like I spread myself thin. You really have to use your critical thinking skills and prioritization skills and make judgments. That being said, you may have to spend a certain amount of time in one room because that patient is more critical and you have to attend to their needs more so than maybe the next room over. Maybe they're in there for a headache, and not to say that a headache can't turn serious, because it certainly can, but you may have like a shortness of breath in one room and then a headache in the other. And so naturally, you're going to want to spend more time with that shortness of breath person trying to stabilize them. And so that person with the headache might feel like you don't really care about them because maybe half an hour went by because you're with that patient and you weren't able to get that person water or something. So sometimes it feels like you can't truly give the absolute best care that you otherwise would be able to in a more stable and controlled environment, because you're running around like a chicken with their head cut off most of the time. And it can be kind of frustrating for that reason, because you want to do your best, and most days you'll probably leave feeling like, oh, I should have did this, or I should have did that, or I could have did this. But you have to understand that in the ER, you just have to give yourself grace. It's impossible to be everywhere at once. And going back to the whole team dynamic, that's why having people to help you out is honestly, it's a necessity in the ER. There's no way to get around to all of your patients without the help of other people. That can actually be a con too. If you're the type of person who likes to work independently, you don't like to have to rely on others to get the job done, the ER probably isn't the floor for you, because it is almost impossible to do anything alone. Now, I know I said you do have a lot of autonomy, and you've got tons. However, there's a lot of tasks that just can't be completed without another person. For example, you may need a second opinion on something. You might need someone else's judgment. You may need another nurse to help turn a patient. You might need help with an IV. There's a lot of things that you have to rely on your coworkers for. And so if you're a person who this is very uncomfortable for you, and you truly don't like to have to go to somebody else for some assistance once in a while, then the ER most definitely isn't the place for you, because I need my coworkers' help all the time, 24/7, actually 25/8, because 24/7 just wouldn't be enough. Another pro to working in the ER is that you get exposed to all different types of nursing everywhere. You get exposed to hospice patients, psychiatric patients, medical to your non-medical, your acute to your non-acute, adults, pediatrics. You are just exposed to literally everything all across the board of nursing. And for that reason, I think it's great, because you become not exactly a master of one, but a jack of all trades, if that makes sense. And I think that as a nurse, that's super beneficial, and that could take you into a lot of other opportunities in the future, because you've been exposed to so much. You've proven yourself to be pretty dynamic, pretty flexible. You've got experience in all different realms of nursing. And so I think the ER is actually a great place to start, because even if you don't end up there forever, you will certainly be exposed to the things that you like and what you don't like. And I think it's just a really good setup for nurses in general to be able to move to somewhere else in the future. A con to ER nursing is that it is pretty freaking messy at times. To some degree, all of nursing can get that way, but in the ER in particular, a lot of times you won't even get a chance to clean your room, because you're just running around all day long and you may just not get to it. And so if you're a very detail-oriented, organized, clean person, the ER is probably not for you, because sometimes somebody might be bleeding everywhere, or you just have this person who's crashing and your room just becomes a disaster. You've got blood, urine, whatever, all over the floor, and it's just, it can be really messy at times. So that could definitely be a con. And the last point I want to make, it can either be a pro or a con dependent upon your personality, but the ER is not a very detail-oriented place. There's the right way to do things, and then there's the ER way to do things, as I like to say, because you just don't have the time or sometimes the resources in the ER to be perfect, spot on, meticulous. It's just not going to happen. If you've got a person that's crashing, you just have to do what you have to do to be able to save their life, seriously. And so You know, for that reason, I really like it because it takes a lot of pressure off of my shoulders, especially as a new nurse, to have to be like perfect all the time. I think that can be very overwhelming and frustrating because as humans, we're just not perfect, you know? So the ER is a great setting for me for that reason. But again, if you're somebody who is super detail oriented, very, very like organized, and you prefer things to be done a certain way, maybe like more of a type A personality type, the ER can be for you, but you might get frustrated really quickly once you realize that most people just don't do things one way. Everyone's kind of got their own way to getting things done. And the important thing is that we get it done, right? Like that's what the ER is all about, just getting it done. The squirrel never came back. I'm sad because I wanted to show you. So that is it. That's all I have for you. Those are my pros and cons of working as a nurse in the emergency room. It's a great experience. I do encourage anyone and everyone to try it out. If you're just curious, I think you will learn so much from the ER, and it's super, super beneficial and really fun. And you'll meet a lot of cool people too. That is all I have for you for now. If you enjoy these nursing related videos, please subscribe, leave a comment down below. I answer everything, and I'll catch you guys in my next video. Happy December, baby! Woo! Santa is coming to town.